All right, welcome to your ultimate revision session on performance-enhancing drugs for your GCSE PE exam. We're going to cover absolutely everything you need to know to smash those questions.
Okay, so here's our game plan to get you exam ready. First, we're going to look at why an athlete would even risk it. Then we'll dive into the different types of drugs. After that, and this is super important, we'll break down how to actually answer an exam question. And finally, we'll wrap it all up with a quick-fire revision summary.
Right, first things first, we have to get our heads around the big question, why would an athlete ever consider using PEDs? And really, it all boils down to one thing, pressure.
And this image, it just sums it up perfectly, doesn't it? You've got this massive choice. On one side, there's the dream of glory, winning, everything you've worked for. But on the other, you're looking at ruining your career, your reputation, and even your health. It is a huge, huge gamble.
Okay, let's get into the real nitty-gritty, the stuff you absolutely need to know for the exam. We're going to go through each type of PED one by one. We'll look at what it does, which athletes might be tempted to use it, and of course, the pretty serious health risks.
So first on the list, and it's a big one you've probably heard of, anabolic steroids. Basically, these are all about power. They help athletes build more muscle and recover faster, which means they can train way harder and for longer.
But here's the crucial bit you have to remember for your exam. Those physical gains, they come at a massive cost. We're talking serious, long-term health problems, high blood pressure, liver damage, and it's not just physical. It can really mess with your mood, too.
Okay, now for something completely different, beta blockers. The best way to think about these is as a calming drug. They literally block the effects of adrenaline, slowing your heart rate. So you can see why they'd be used in sports that need a super steady hand, like archery or snooker.
But, and there's always a but, messing with your heart rate like that is pretty dangerous. It can lead to really low blood pressure, nausea, and can even affect your mental health. In the worst-case scenario, you're looking at potential heart failure.
All right, next up are diuretics. Now these have a couple of uses. The main one is for rapid weight loss. So think about sports with strict weight categories, like boxing or horse jockeys. But there's a sneakier reason too. Athletes use them to try and mask other banned substances by, well, flushing them out of their system before a drug test.
And the biggest danger here? It's pretty obvious, really. Severe dehydration. Forcing your body to lose that much water puts a massive strain on your organs, especially your kidneys, and can lead to all sorts of problems like cramp and headaches.
Okay, narcotic analgesics. In simple terms, these are powerful painkillers. And the key thing to understand is they don't fix an injury, they just mask the pain. And you can see how dangerous that is, right? An athlete might keep training or competing on an injury, making it so much worse, maybe even ending their career.
And yeah, the health risks are huge. The big one is that they're highly addictive. But on top of that, they can mess with your balance and coordination and cause some serious long-term damage to your liver and kidneys.
Right, let's talk about peptide hormones. And this is interesting because we're looking at two different types that do very different things. You've got EPO, which is all about boosting endurance for athletes like cyclists. And then you've got HGH, which is for building muscle and strength, so think weightlifters or sprinters.
And, you guessed it, messing with your body's natural hormones can have some pretty catastrophic consequences. Take EPO. By creating more red blood cells, it actually thickens your blood. Think about it, it's like trying to pump sludge through your veins. That massively increases the risk of blood clots, strokes, and heart attacks.
Next up, stimulants. And these pretty much do exactly what they say on the tin. They stimulate the central nervous system to make an athlete more alert and aggressive, and to fight off tiredness, so you'll see them used in really intense, high-octane sports like rugby. So what's the trade-off for that extra focus and energy? Well, it's a huge risk to both your physical and mental health. Stimulants can be super addictive, cause anxiety and irritability, and put a really dangerous strain on your heart. Okay, this next one is a little different. Blood doping. It's really important you remember this is a process, not a drug. It's where blood is removed, stored, and then re-injected to artificially boost the number of red blood cells. And the goal is to get more oxygen to the muscles, which gives a massive advantage to endurance athletes.
Now the risks are similar to EPO. Thickening the blood can lead to clots and strokes. But with blood doping, there's a whole other layer of danger. You're dealing with needles and blood transfusions. If the equipment isn't completely sterile, you could get a life-threatening infection like HIV or hepatitis. It's incredibly dangerous.
All right, so we've covered a ton of information.
But how do you actually use this to score marks in the exam? Because knowing the facts is only half the battle, right? Let's break down how to build the perfect answer.
Okay, so here's a classic 2-mark question you might see. The key here is to see what it's asking for. You need to explain why a performer would take it, and you must use a sporting example.
So how do you get both of those marks? It's actually a really simple formula. Mark number 1 is for stating the fact. What does the drug do? So anabolic steroids increase muscle mass. Boom, 1 mark. Mark number 2 is for applying that fact to a sport. For example, a sprinter could use that extra power to run faster. That's it, 2 points, 2 marks.
Okay, to wrap things up, let's pull all of this together into one ultimate cheat sheet. This is going to be your go-to revision tool to make sure all this information really sticks. Okay, get ready to screenshot this slide. Seriously, this is your ultimate revision summary. We've got the drug or the method, what it does for performance, a key risk to remember, and a perfect sporting example for each one. This table has everything you need for some powerful last-minute revision.
So, we'll leave you with this final thought, which really gets to the heart of this whole topic. When you weigh up that immense pressure to win against all the physical, ethical, and professional costs, is it ever really worth it? Something to think about. Okay, that's it from us. Good luck with your revision, and smash that exam.